Good afternoon, everyone. Welcome to today's webinar, Tools and Tips to Help You Establish a Strong Children's Vision Health Program. Just as a notice to everyone, we are recording today's webinar so that we can have it posted on our website for people to view at a later date. And we will be muting people's lines just to help cut back on any extra noise in the background. This webinar is hosted by the Wyoming Vision Collaborative here at the Wyoming Institute for Disabilities. We're funded by the Wyoming Department of Health, as well as donations from the Wyoming Lions Foundation and the Miracles in Sight Foundation. Today we have a presentation by Baldonado. She's one of our stakeholders in the Vision Collaborative group. She's the director for the National Center for Children's Vision and Eye Health at Prevent Blindness. We have been working closely with Kara to inform and guide the development of a statewide screening program infrastructure for Wyoming. She's been very helpful in sharing information about current research in eye health and other nationwide initiatives. In a minute, I'm going to hand the floor over to Ms. Baldonado. Please note that we will have time for a brief question and answer period at the end of today's presentation. If you have any questions or concerns during the presentation, you are able to type into the text box and can either post the question to everyone or directly to me. So please feel free to put any messages in the text box at any time if there's any questions or concerns, especially with technology. At the end, when we go to the question and answer period, we will unmute everybody's lines so that you can go ahead and chime in. Also, we have posted in the text box a link to today's captioning services for the event. If you would like to view the captioned text, please open the link in a separate window on your computer, and then you can shrink the box down so that you can view the text along with the presentation.
Okay, there we go. Well, welcome everybody to the webinar. I'm Kara Baldonado, as they said, and Director of the National Center for Children's Vision and Eye Health. And today my goal is to provide some tools and tips to help establish or strengthen your existing children's vision health program. So my objectives are to describe the 12 components of a strong vision health system of care, to describe some tips to improve the follow-up component of the vision health program, which is the most critical part of the program, and to describe 3 ways to improve vision screening effectiveness. So we want to do things well. We want to make sure kids get connected to care. We want to make sure that they follow up with the treatment that is recommended from the eye care professional. So hopefully today's presentation will help you give some tips to make it to those steps. So many times in the conversation, we talk about doing a better job of vision screening. And here at the National Center, we have a line of thought that we really want to take it from a better vision screening to a better vision system for children's vision. Within the scope of a system, there are a lot of different things to consider as you put your vision health program in place. So we're going to have a little trip around the clock here. So first and foremost, caregiver education. If parents don't understand why it's important, if they don't understand the results, and they don't understand the role that healthy vision can play in the child's education and learning ability, then they're not likely to follow up on recommendations. Making sure that you have parent permission not just to do the screening, but also to share results as needed within HIPAA and FERPA guidelines. Use evidence-based practices. Every day there's a lot of cool new stuff coming out on the market. But we want to make sure that the tools that you're using for vision screening are the right tool for the ages that you're targeting, and that they're the right tool for the developmental stage of the child that you're screening, and that they are really designed to do what you want them to do. Organizational policies are kind of the keystone of making sure that things happen in a consistent way and that the information that comes out of the program is used in a consistent way. So you need to have some strong policies in place. You want to make sure that you have a standardized approach to rescreening and referring. Oftentimes we hear that this is an area of concern for people that do vision screening. They aren't quite sure when they should be rescreening a child and when they should be referring a child. So having standardized approaches to that is important. Cultural competency is an important consideration for children's vision. There are many cultures that don't believe that children should wear glasses. They think it has a negative connotation on their child's appearance in society. There are many cultures that think it shows a deficit or their child isn't as strong as the others. So there may be some cultural beliefs, either to corrective eyewear or to accessing an eye care provider, that need to be overcome to make sure they improve follow-up. Ensuring follow-up is obviously a key component to making sure that you have some sort of record system in place is going to help with that. Linking to resources, not just for the parents to eye care providers, that's important, but there may need to be linkages to getting free eyeglasses or assistance in paying for eyeglasses, linking eye care providers with your program and letting them know what you're doing. So there's a lot of different types of resources you want to make sure that you're linking to. Making sure that you have eye exam outcomes on file, and that's going to come in the data piece that we talk about later, and making sure that what you're doing in your vision screening program is matching up with the eye exam outcomes, and if they're not, what kind of changes do you need to make. Making sure there's good provider communication. Vision screening has kind of been plagued along the way to live in silos, where we do vision screenings in Head Start, and we do vision screenings in primary care, and we do vision screenings in public health, and everybody does them all on their own thing, holding their own data to themselves. And oftentimes that can lead to a lot of duplication of services, confusion by the parent of the child that's going through all these different systems, and it's just unnecessary. So if we can improve provider communication, we can make sure that, well, we're enforcing the referral that's made to vision screening, we're making sure kids get connected to eye care, and the results from screenings and exams is getting back to the people that need those information. Making sure that treatment plans are understood, not just by the family, but also by the people that are helping to make sure treatment plans are adhered to. So if a child is patching while they're under care of an early education provider, then maybe they need to make sure that they're aware of that there's a treatment plan on file in their system, and that patch is worn during the correct hours while they're under their care. And then finally, having an annual evaluation. There's no perfect system for children's vision health. There's always some area that can be improved in. So taking a step and at the end of the year and saying, hey, you know, how have we done? How are we doing with our vision screening practices? How are we doing with our connection to parents? Do they feel educated? Are we reaching all of the cultures that we serve within our program, and our kids getting the care they needed? So making sure that you take a moment to evaluate each of these 12 pieces every year will be a worthwhile way to continue to improve your program. So what are the things that you can focus on to create a great vision health program? One, making sure that you participate in actions to support sound policies. And that can be a scary thing for some people. So when you talk about forming policies, you think, oh, you know, Head Start does that at the federal level, or my boss does that for our organization. Policy development can be at any level along the way. So, you know, consider, how do you develop the policies about your own workflow? How can you develop policies for your program, for your county, for your region, for the state, and then how can you contribute to policy development federally? The voices for everybody, that, especially for those that are on the ground doing the vision screening and have outcomes and impacts of these policies to report, we especially need those voices to help kind of build up the flow to that federal level to say, hey, this is working, this isn't working, here's why, and how can we change it? So there's a lot of great opportunities to participate in forming policies. You can also take steps to support your families, and I'll talk about different ways that you can do that here in a moment. But families are all over the board with their needs, and you never know what's going to be that one thing that prevents them from taking that step to follow up to eye care. So trying to have a strong support in place is going to help prevent some of that lack of follow-up. Employing uniform and evidence-based approaches to screening, and I think I touched on that. and ensuring effective communication among all of the stakeholders. So I'll talk about some ways that you can pull in some of those local eye care providers, that you can pull in families and family advocates to help improve the outcomes to your vision program. And number 5, engage in data sharing opportunities. And that sounds maybe a little scary for some people, but there are, as I said, these silos that have been along the way of all these people that care about children's vision. And the more that we can look at opportunities to share data in an appropriate way with appropriate securities in place, then we can have a better focus on the child rather than all of our screening procedures and numbers of how many screened, how many referred in place. We need to make sure that we're tracking the child, not how many people we're screening. And then assess your competency, as I said. Are you really making a difference, or do you need to make adjustments in how you're screening or following up or supporting families? So let's talk a moment about strong policies, and I'll have a couple of different examples there. So there might be different areas of policy change that you want to put into place. Your screening methodology and periodicity are a couple of different approaches. So, and this might be for your program level or the state. You know, how are we going to screen children in different age groups? And what is the evidence that drives practices within those different age groups? How you screen a child in the preschool age is going to be different than how you do it and how often you do it at school age levels. There are different needs, different reasons for screening in these different age groups, to make sure that you have strong policies in place about why you do something and when you do it. Policies around data collection approaches. And this is, if any of you are familiar with the Early Childhood Data Collaborative, they have a lot of great guidance information around data collection, especially in early childhood. But when you look at putting together some data sharing or data collection policies in place, there are a lot of security and user guidelines that need to be put in place. And it's really important to stop and take some considerations of what data are we going to be collecting, who's going to have access to that data, how do we know it's secure, and when we do share the data, what do we share, what's the guidelines in place. So starting with policy development around these issues is going to stop a lot of questions later on down the road, so it's very important. Having some training approaches as a part of your policy development is also important. So how are you going to train the individuals that are doing the vision screening? How are you going to train the individuals that are handling some of the data coming in and going out? And what are the different certifications or requirements for people at different levels? And how is that built into employee responsibilities or volunteer responsibilities? And what do you have on paper for those individuals to adhere to? Also, you need to have some policies around the non-typically developing child or those who may be at increased risk for a vision problem. There's a lot of alignment around this area between the American Academy of Ophthalmology, AOA, the American Academy of Pediatrics, Bright Futures, Prevent Blindness, and the National Center. We all agree that those children who are not typically developing, they may have cerebral palsy, they may have neurodevelopmental delays of some sort or another, or on the autism spectrum, or those that have an increased risk because of a strong family history of amblyopia or some other vision condition. Those are kids that we know are not asymptomatic. They're going to have that much higher likelihood of a vision problem. It's critical that they get connected to an eye care provider and establish that relationship so that they can maintain the right periodicity for their vision health and their condition. So those are kids that do need to be connected to an eye care provider rather than screened, according to those policies. And then make sure that your full system of vision health, as I went around that clock, that full system, make sure that that's reflected in the documentation of what you're collecting and the policies. So one of the examples I wanted to share of how that full system is developed in a policy is the policy that's in place by the Administration for Children and Families and the Office of Head Start and their vision health policy. So many of us are familiar with the fact that in Head Start and early Head Start programs, within 45 calendar days of the child's entry into the program, the child's vision, they have to have a vision screening on file for that child. But there's more to this policy on down the road that shows how they're addressing more of that full cycle for vision. So that if there is guidance from a mental health professional or a child development professional, then that considers the needs of maybe a non-typically developing child, and that would cause some action on the end of vision care for that child. They must utilize multiple sources of information, so they're aligning communication along providers on all aspects of the child's health, development, behavior, and making sure that they engage the family members, teachers around what they're going to do for that child. So there's a lot of alignment of communication and sharing of data. And then extended follow-up and treatment. These programs have to have a system in place of ongoing communication and making sure the child not only gets referred to an eye care provider if they need it, but also gets the care from the eye care provider and follows the treatment plan. So you're kind of seeing how they're working around that clock of, making sure the families are involved and educated, they have alignment of communication, sharing data, and making sure there's follow-up to treatment. So that's a good, strong policy. For those in Head Start and Early Head Start, no, there's still a lot of gaps in it. Like I said, nobody's perfect, but at least there's an adherence to more of that whole system approach. Another more programmatic level approach to policy I wanted to share comes from the group that we've been working with at the Pediatric Physicians Organization at Boston Children's Hospital. So they did a lot to analyze what was happening in their vision screening system and reviewed their records and found that a vision screening referral was the most common referral from a well-child visit that they had in their pediatric practice at Boston Children's Hospital. And so they took a lot of efforts to train the staff, and they purchased a lot of different equipment and tried different things out. So they went ahead and tried it out, evaluated, and kept refining and training what they're doing, and figured out that one of the linchpins for what they were doing to making sure kids got follow-up to care was to change the status of the referral that they made. And so maybe this is something that can happen within your own program. So typically when they made a vision screening referral status, it was a low priority status. So there were no extra efforts put around making sure that kid got follow-up to an eye care provider. So they changed the status of a vision screening referral to critical. So this would be similar to if a child was referred to a cardiologist or an asthma specialist, something that was critical to their overall development and survival. So they changed the status to critical. So that engaged different types of follow-up supports for this pediatric practice, meaning that there was enhanced communication with the family and that there was confirmation that they got follow-up to care. So that changed the status of the way the child followed up to eye care incredibly, also changed the way the families were educated incredibly. And that was a huge difference for their follow-up and success in children's vision, and a big policy change for them. So let's talk a few minutes about how we're supporting families. So as I said, there's a lot of different things that happen in the world of families of why they do or don't follow up on an eye care referral. So maybe it's a language issue that many of the pieces of information they're getting back about their child's vision is a letter in English, and English is not their primary language. So they don't necessarily understand what's happening there, and if they're depending on their child to interpret for them, they may miss some critical information. Or the text and the information they're receiving is not easy to understand, can lead to some confusion about what their actions should or should not be, and they're really not sure what the right steps to take are. So they may turn to other individuals who can then lead them down the wrong path in relation to their child's vision. As I mentioned before, there's a lot of mistrust for providers, especially for individuals who may not be native to this country if they've come from other countries. There's a lot of poor actions on the part of some healthcare providers in other countries that may have led to feelings of mistrust about healthcare providers in general. So the families may be kind of reserved in taking steps to follow up with an eye care provider that they're not familiar with. And finally, there's access issues that many of us are familiar with, that the families have to take time off work if they have other children that they need to get care for so they can take their child to an eye doctor. If the transit system that they need to use doesn't mesh well with the hours of the office when it's open, then it's pretty much not going to happen for those children. So there's a lot of different things that can happen within the program to help support families. First, as I mentioned, obtaining written approval is going to be important to make sure that you can take those results from the screening and help share them with the child's medical home, who can also help link up to other specialists such as an eye care provider, or share information with an eye care professional that may be working with your program to help that family connect to care. Have lists of eye care providers available so that people know who the local eye care providers are. Maybe they're new to the area, they don't know where to go to get eye care, and so having some local eye care sources available is going to help them get that follow-up step accomplished sooner. And connect parents with peers that can assist, and I'll talk more about how to establish a peer support program within your organization and what kinds of things that a peer can do, a parent that has been through this can do to help assist families. Provide information that's easy to understand and act on. As I mentioned, if you give a highly technical letter to families that are just not operating at that reading level, or look at it and say, I don't see clearly here what the next 3 steps are for me to do, then they may put it aside and say, I'll think about this later. And if you have 2, 3 kids to think about, that later doesn't happen. I know how the school papers stack up. And then respecting cultural and literacy needs. You need to be able to communicate what actions you're expecting that family to do in the language and cultural approach that they are comfortable with. If not, then again, it's going to be put to the side and dealt with later when it never comes. So as I mentioned, some of those peer support programs may or may not be a new thing for your program. There are many that have some peer support or parent advisory committees that work with programs. But when it comes to eye care, there's some specific ways that those peers can assist. Providing parent-to-parent conversation. So one of the examples that I had is a screening program that we did in a private preschool where many children were screened, and there were a few children identified with potential amblyopia. So the children followed up to eye care, and the screening program was very good in keeping up on making sure kids connected to eye care, what the outcomes were, what treatment is needed. And there were parents who were very good with connecting and following the treatment and getting the kids through the issue of amblyopia to improve vision. And as the years passed and they kept going back to that same school, they kept seeing some of the same kids come back with the same results, and yet no treatment is being adhered to by the parent. So they asked if the one parent that had been through amblyopia treatment and their child had improvement, if they were willing to speak to another parent to see what maybe their concerns were, or to see if they had any misconceptions or beliefs that need to be dealt with around the treatment. And they were open to that. So the 2 parents talked to each other, and the one parent that had been through the treatment helped the other one understand the importance and made them more comfortable, helped deal with feelings of guilt, which was blocking that parent from following up, and really just made them realize the importance of going ahead with that treatment. And then finally that child did get the amblyopia treatment that he needed and had improved vision. So that parent that was originally resistant to it really opened up through the help of one of their peers, even though they heard this from the preschool and from the screeners and everybody else that was involved saying it's important. It was that peer that made the difference. Also, peers can act as personal advocates. So again, if there are families that are not comfortable in a healthcare environment for one reason or another, then maybe they can go with the family for an appointment to help ask questions or record information. To provide translations. Again, you don't want to always be dependent on the child of a family to provide that translation. So there may be families within your program that are willing to help translate for others, either documents or at appointments of what's happening, so they can have that conversation or communication in their native language. Peers have also helped parents access or get the child to an eye care appointment. As I said, sometimes it's those working hours that make a difference. So if the parents just cannot get access to an eye exam during those working hours, they can't take the time off, other parents and families have helped get children to eye care appointments. And again, that peer support, the treatment adherence is important. We have that through virtual online peer to support networks on our website, but also just to have that person say, you know, I've been through this, I understand the child doesn't want to wear the patch during the hours, here are some tricks and things that we've done to help make it a little bit easier, is a big relief for families that are going through that stress. Also, some of those families that have been through it might be able to provide educational sessions to other parents and children. So maybe before a screening program starts, one of those families who has benefited from the screening program might just stand up and say, hey, you know, here's what happened to my child. He went through the screening, he did fail, we had to go to the eye care provider, and here's the outcome of the treatment that he had. Here's the difference it made. So just saying that in an educational moment for parents, even before the screening starts, can help alleviate some of those fears that may come after the screening referral letter is sent home. And if you have families that work with you on that advisory committee level, they can help set goals for your eye health program. So they can help evaluate that success on an annual basis and say, you know what, I think this is an area that we can work to improve in. Here are some ideas that I have. Engaging those families is critical to make sure you have a successful program. So on the National Center website, we have a variety of different resources that can help you out. So we have financial assistance programs that are from all different types of programs nationally, but many of whom also have state level assistance. The benefit of that resource is it has information for children and adults. So oftentimes if the issue is the parent has a vision problem too, and they can't get the help they need and don't feel comfortable taking the child, maybe they can get assistance through this program too. We also have sample vision screening referral documents. On one side, it captures all the information from the vision screening and it has a location down at the bottom for the eye care provider to respond what the outcome of the exam was. But on the flip side of this document is a letter that's available in English and Spanish of, you know, a nice, easily written, easy to understand letter of your child was referred from the vision screening. Here's what you need to do, 1, 2, 3, and then also has a place for that parent to sign for release of information and who to send that information to. So it just kind of kickstarts that communication process. Then we do have just some basic parent education pieces in different languages. The one you see there is in traditional Chinese, and we also have English and Spanish for that document. We've also partnered with the National Center for Family Professional Partnership, who have developed resources that are more appropriate for the program level. So you have some quick facts about children's eye problems that are appropriate quick training tools for other staff to say, hey, if you notice some of these signs, it may mean the child has a vision issue. So make sure that you let us know they need to have their vision screened or refer them to an eye care provider. And there's also some great posters in different languages that you can hang up around your center or your program to make sure that parents understand just through this visual reminder that vision has a key part in the child's readiness to learn. As I mentioned, evidence-based program practices are critical for children's vision. So even just here in this slide, we have a quick yes or no, what to do, what not to do. There are essential elements of test of visual acuity design that lead to increased confidence in your screening outcome. And there are tests that are poorly designed that can seem like an easy screening tool to use, but really can leave some amblyopia or other vision problems undetected. So design and evidence-based in the screening tool is very important. So just some other examples here on this slide. You see there's a variety of different approaches. I know many of you, a part of this group, are using autorefractors or photo screeners to do the tools. Obviously, there's a lot of great evidence out there for those now and growing more day by day. There's a lot of tests of visual acuity there. You see at the top those with the house, the circle, heart, and square, the traditional Leia optotypes that are easy for preschoolers to use and can be used at a 10-foot or a 5-foot distance. So there's some really great, easy to use tests just for a traditional chart-based alone. And there's evidence-based even around occlusion. So you see there towards the bottom an adhesive patch, which is considered best practice, or specially constructed occluder glasses, which are for the left eye and right eye separately, that are a little more fun, especially for that preschool age group, and prevent peeking a lot better than a paper cup or a hand or some other things that have been proven to not be effective. And then we'll follow national referral and rescreening guidelines, depending on, again, what age group you're going to be focusing on. So those that are screening school-age kids are going to have different referral criteria than those screening younger children which have a little more leeway in the acuity than you would in a school-age child, depending on the development of the child's vision over those ages. For children that do not pass a vision screening, it's really important that you rescreen them as soon as possible. The same day is preferred if at all possible, or you are ultimately referring those difficult to screen or untestable children. With the goal being, we don't want kids to go too long without getting connected to eye care if they really need it. So if you can't rescreen that same day or the next couple of days, you really have a window of up to 6 months max to get that rescreening done. If you know that you're not going to be able to do it within that time frame, go ahead and make that referral. And then again, make sure that you have vision screening training for the staff that leads to some level of certification and is based in evidence-based screening procedures. That doesn't include just going on YouTube and watching a video about how somebody does a vision screening. You really need to make sure that you work with a national certification program to understand why you're using the tools you do, what are some of the right ways to do things, the wrong way to do things, and make sure that you have confidence in the screening that you're going to be providing. And then again, down at the bottom is that policy for direct referral for children with that increased risk. So on our website at the National Center, we do have vision screening recommendations that were put together by a national expert panel comprised of optometrists, ophthalmologists, primary care practice providers, nurses, and many others that deal with children's vision, came together for a consensus document of the best ways to do vision screening for children aged 36 to less than 72 months, so 3 through 5 years old, and that's available on the visionsystems.preventblindness.org website. And there you'll also find recommendations around collecting data and setting performance measures for your program. Some other resources to consider are Prevent Blindness does provide a national vision screener certification that's good for a 3-year period. So we can discuss that individually if you're interested in learning more about that. And then also we worked with School Health to put together a document that's available online called Navigating the Path of Children's Vision Screening, which goes into a little more depth of visual acuity, vision screening instruments, and occlusion techniques. And finally, let's talk a little bit about promoting communication among all providers. So as I said, communication is key. If the information is not getting from one person to the next as you're working your way the child through that system, there's a barrier for some reason, and the child is not going to make it all the way through the system. So try and use a lot of different approaches to obtain outcome for referrals. Some programs gather that permission to communicate with other providers and to help facilitate the referral as a part of their program entry process. It's something that parents sign off on as a part of that process, or as a part of the permission slip that's sent home to do the vision screening. Or again, as I mentioned in our document, that referral letter has a place for the parents to sign off for permission to share the information. And we do promote engaging the medical home. The medical home really is charged with making sure the child is connected to the specialty providers they need. So whether they did the vision screening themselves or not, if there's strong communication between the child's early education environment where the screening took place and they understand that child was referred and the family hasn't followed up yet, then maybe that medical home can engage and say, hey, you know, we see there's a referral. Why haven't you followed up? What can we help you with? And can we connect you with some eye care providers that can assist you? And then make sure to support treatment plans and engage visual impairment specialists if needed. So it doesn't just end when the eye care provider sends their information back. If that child needs support, making sure their amblyopia treatment is here too in the classroom, if they need to enlarge letters and have things duplicated or in different colors for them while they're in the classroom, then you need to have that treatment plan in action for the classroom too. And developing relationships is something that every program to do. So there are a lot of different ways that you can develop relationships with an eye care provider for your program. A big part of it is just to go to the eye care providers around your program and find out who they are, what age of children they're comfortable seeing, what types of insurance they can accept, and then you can create a list of those providers and keep them available for your families once the child is referred. You can discuss the vision policies of your program with that provider. They can help you refine them if needed, and they'll understand why some people are being referred to them. And understanding your policies, they can help be a better communicator from your program's perspective to why they're following up with a family. And as I said, create that resource listing. And this is a project, again, for maybe some of those parents to be engaged or a college student in the area. This is a great project for them to work on to help support your program. And invite providers to visit your program and talk to the children about eyes and vision. We highly recommend that the first time that the kids hear about vision and that the family hear about vision is not the referral letter from the vision screening back to them. Vision health should be a part of the overall education and communication that you provide in your program. And here are some other resources that we have on our website for those kids that are wearing glasses for the first time. We have a nice little simple tips for wearing eyeglasses sheet. We have that referral document to help encourage communication. And for those kids that are going through amblyopia treatment, we have what's called the Eye Patch Club, which is a newsletter, that online forum for parents to talk to each other, and a patching calendar that kids can use to keep track of their treatment adherence process. Let's talk a moment about data tracking and sharing. And just want to reiterate that we need to get out of our silos. I know data is the way that we measure our accountability to the programs and what we're charged with, but I just want to put it out there that our accountability ultimately is to the vision health of the child in this situation. So the more that we can seek to integrate our data across the different providers, the better job we're going to be doing of following the care of the child versus the accountability to a program. So there's one way you can do that is by bringing different stakeholders together and seek uniformity in the data points that you're collecting around vision. So if people are collecting similar data, then it's going to be easier to compare outcomes when you're talking to each other. And make sure that you do set some outcome for yourself as a part of your vision measurement. You know, how do you want to improve? Is it just how many kids do we screen and how many more can we screen next year? Or what happens with those kids that we refer to follow-up? Do they get that follow-up, and what percentage does? And maybe you can drill down to what kids aren't getting follow-up and see if you can find patterns and then target your program intervention to deal with those patterns. And make sure that somebody is looking at the data. So again, this kind of goes back to your policy and staff training, is to assign responsibility for who's looking at that data and what can they do with it, and use that for your program evaluation on an annual basis. So there's a fun little picture here that I'm just going to put up on the screen for a moment and have you guys look at it. And it looks like a pretty typical vision screening that you might see in a Head Start or some other program. But there's several things here that just aren't being done to an evidence-based approach, or they're going to result in the best possible measure of acuity in this child. So some of the things I wanted to point out in this picture is they're including with a paper cup, and the person holding the cup is kind of sitting behind the child. So they're not really able to see if the child's peeking out, even just if that cup's lifted up a little. They can't see if the child's peeking out of that cup or not. Also, on the charts being used at the far end of the wall, I'm at least glad to see it's a log mark format, so it goes down in that sort of upside down triangle that we look for. But you see the person pointing to the chart is pointing to individual optotypes, which makes them easier to see along the way. Also, the presentation of a full chart like that is pretty overwhelming for preschool age kids. So there's a lot of other tools out there now that present fewer optotypes that still have the same effectiveness of a visual acuity measure. So there's a lot of updated evidence-based tools. So just in this simple little picture, there are a lot of things that could be taken to improve the approach to vision screening. So some of the things that you can do to make sure you're doing the best job is to compare your screening results to eye exam outcomes. Make sure that you have current training certifications for all the staff that have responsibilities for screening and making referrals. Review all your vision screening tools annually to make sure they actually work well, so none of those eye charts are cracked or broken, that you have working occluders, that your software is updated in your vision screening devices if that's what you use. And make sure that you review your vision screening program results with any health advisors you may work with. Say, hey, here's what we're doing, and do you see any areas that you have concerns with or areas we can improve on? And finally, make sure that you take efforts to share your vision screening data with other community stakeholders. How does the vision screening data from the Head Start compare to the public health outcome data? And are the two of you seeing any patterns between what you're doing? And there's opportunity then for collaboration to try and improve the patterns that you see. There is a resource for program evaluation that goes through each of those 12 pieces that were on that clock, and it's called the Annual Vision Health Program Evaluation Checklist. So it takes each of those 12 pieces, and in simple yes or no questions, you can easily identify areas that you want to improve your vision health program in. And then in the last page of this document, it creates an action plan for you to target your prioritized areas for improvement. There's a lot of these things that I spoke on our website, so I just wanted to put that up there again. So there's educational tools, opportunity for professional development, resources for families, and you can write in and get technical assistance from us. We're happy to help you at any time, so feel free to use that website. And then also within our website is an area called the Year of Children's Vision. So for those of you that might be in an early education environment, there's a lot of additional resources targeted for you in those situations as well. So there's a copy of the website there and the web address. So nationalcenter.preventblindness.org/yearchildrensvision. So thank you for your time. I think I'm hitting right where I want to be. So I will stop here and answer any questions you might have.
And then just a quick reminder, if you did not register for this webinar, especially if you're interested in getting STARS credit for attending, please do use the link on the flyer to register, and then I can submit any information for you to get STARS credit. With that, if I don't hear any questions, I want to thank you all for joining us. As a reminder, this presentation will be made available on our website at uwyo.edu/win/vision/trainings. We hope to work with you all further as we continue to build an effective statewide system for vision screening. So thank you all for joining us today. Thank you again, Kara. We really appreciate your presentation and your partnership as we build up Wyoming's vision screening program. So have a great afternoon, and thank you.